We all adore puppies, right? I mean, those little bundles of joy,
Yeah,
endless energy, and just boundless curiosity.
totally. They get into everything.
Exactly. And as pet parents, our deepest desire is just to keep them safe, healthy, happy.
Sure.
But what if the very medications we rely on for our own aches and pains could actually be deadly for them?
Mm-hmm. It's a scary thought.
It sounds like a simple question, but the answer, well, it reveals this critical, often overlooked danger, something lurking in, like, almost every home.
It really is that common.
So today we're doing a really crucial deep dive. We're looking into NSAI toxicity in puppies.
Right. NSAIs, non-steroidal anti-inflammatory drugs.
Yeah, the stuff we all have, common over-the-counter pain relievers. They're staples in our medicine cabinet.
Advil, Aleve, aspirin, things like that.
This deep dive, it's based on a really comprehensive guide called NSAI Toxicity in Puppies, a pet parent's guide. It's just packed with vital, potentially life-saving info.
It is really good information in there.
So our mission today is basically to cut through any confusion, give you the most important facts about this NSAI toxicity.
Yeah, get straight to what matters.
And arm you with the knowledge. How to recognize symptoms, how to respond effectively, and maybe most importantly, how to prevent this, because it seems like it is preventable.
Oh, entirely preventable. That's the key message.
Okay, let's unpack this then. So let's start right at the beginning. What exactly are NSAIDs? You mentioned a few.
Right. So they're common medications we use for pain, inflammation, fever, things like ibuprofen, naproxen, aspirin.
The usual suspects.
Exactly. And they work by blocking certain chemicals in the body called prostaglandins.
Prostaglandins.
Yeah.
Okay, but the really big point here, the crucial distinction.
Yes. What's absolutely critical to understand right off the bat is that very, very few human-approved NSAIDs are safe for dogs at all.
So even though they work for us, huge risk for dogs, especially puppies.
It's a found risk, yes.
That distinction is just paramount. It's one thing to say they're dangerous, but knowing which ones are the definite no-goes.
That's vital.
Yeah.
So specifically, we're talking ibuprofen, that's Advil, Motrin, naproxen, Aleve, aspirin, of course.
Okay.
And while it's not technically an NSAID, we have to mention acetaminophen Tylenol, also highly toxic to dogs.
Tylenol too. Wow. Okay.
And it's not just pills, even some topical creams, eye drops,
Yeah.
if you lick them or absorb them. There's one chemotherapy drug, Fluorocell.
Oh, yeah.
If a dog licks that off your skin, it's actually a leading cause of poisoning deaths. It's incredibly toxic.
That's terrifying. But there are safe ones for dogs, right?
Yeah.
Vet-prescribed ones.
Yes, absolutely. In stark contrast, vets do prescribe specific NSAIDs formulated for dogs, like carprofen-rimidol is a common brand name, Daracoxib or Daramax, Firocoxib Previcox, Meloxicam Medicam.
Okay, those sound familiar from vet visits.
Right. These are tested, they're approved for canine use, and they're generally safe when prescribed and supervised by a vet.
So the key word is veterinary specific.
Exactly. You can't just swap them out.
So the core of the problem, the why behind this danger, it's
Yeah.
about how they metabolize these drugs differently.
Precisely. It boils down to fundamental biological differences. A dog system processes these drugs much, much slower than a human's does.
Slower. So what does that really mean then? Like if my puppy eats one, 24 hours later, is it still actively causing harm?
Yes, potentially. It means the drug stays in their system longer, it builds up to higher concentrations, more toxic levels.
Ah, okay.
We clear these meds relatively quickly. A dog's body struggles, it accumulates. And for ibuprofen specifically, the margin of safety is incredibly narrow.
A narrow margin.
Meaning
Yeah.
the difference between a dose that might theoretically help, which we don't recommend trying, and a dose that causes serious harm or death is tiny.
Wow.
For a small puppy, even a crumb of a human pill can be like a massive overdose. It's just completely disproportionate because of their physiology.
And that mechanism you mentioned, prostaglandins, you said they block them. Why is blocking them so bad for a puppy?
Right. Well, prostaglandins are chemical messengers, but they kind of wear different hats. Some cause inflammation and pain. Those are the ones NSAIDs target, which is good for us. But other prostaglandins are absolutely vital. They protect the stomach lining, they ensure good blood flow to the kidneys, they support liver function, they help blood clot normally.
So the good ones.
Exactly, the good protective ones. When human NSAIDs block those too, that's when you get severe multi-organ damage. And it can have a fast.
Puppies. They're
Yeah.
extra vulnerable, right?
Yeah.
Because they're so small.
Exceptionally vulnerable. Their smaller body size means even one single human tablet can be an astronomically high dose for their weight.
Can you give an example?
Sure. Think of a tiny puppy, maybe 1 or 2 kilos, that's like 2 to 4 pounds. If they ingest just one 200 milligram ibuprofen tablet,
Yeah.
that dose could be anywhere from 100 to 400 milligrams per kilogram of their body weight. That's squarely in the highly toxic range.
Just one pill. Wow.
And it's not just size. Their organ systems are immature. They literally have less capacity to detoxify and eliminate these drugs.
Because their bodies just can't cope.
Right. They don't have the physiological reserves.
Yeah.
The damage can be more profound, more irreversible, longer lasting than in an adult dog. It really shows why even a tiny amount is so devastating.
Okay, we've talked about the why. Let's maybe give people a clear picture of the scale of this danger. Not necessarily exact numbers, but just how much is too much.
Yeah, you don't need to memorize the figures, but understand the progression. For ibuprofen, even a very small amount, a fraction of a pill, can cause vomiting.
Okay, that's the first sign, maybe.
Often, yes. As the dose increases just a bit, you're looking at severe internal damage ulcers, bleeding in the stomach or intestines.
Right.
A bit higher still, and acute kidney failure becomes a major risk.
Kidney failure. That's serious.
Very. And at the highest doses, you can see neurological effects, depression, seizures, even coma.
Oh my gosh.
And what's really surprising, kind of shocking actually, is that even half of a standard 200 milligram ibuprofen pill can be toxic to a, say, 25-pound dog.
Half a pill for a 25-pound dog, so for a tiny puppy.
Exactly. The danger is magnified immensely.
That really drives the point home. What about other common ones, like naproxen?
Naproxen, like Aleve, is actually even more potent than ibuprofen. Signs of toxicity can show up at incredibly low doses.
Well, lower than ibuprofen.
Yes. For context, like a 10-pound dog could be in serious trouble after ingesting only about 25 milligrams of naproxen. That is a tiny, tiny amount.
Oh, okay. Aspirin?
Aspirin.
Yeah.
Historically, is sometimes used very carefully by vets, but it can cause severe stomach ulcers, perforations, liver injury, not something to ever give casually.
Right. And Tylenol. Acetaminophen.
The acetaminophen, again, not technically an NSAID, but always lumped in because it's so dangerous for pets. It causes severe liver failure, damages red blood cells. Really, the rule of thumb for acetaminophen is any amount is dangerous for a dog. Just avoid it completely.
Got it. Okay, so recognizing the signs is obviously crucial, but you mentioned it can be tricky.
It can. Symptoms vary based on, which NSAID, how much they ate, the puppy's general health. Early signs, especially the GI stuff, often appear within maybe 2 to 12 hours.
2 to 12 hours. Okay. But here's where it gets, frankly, really alarming. You mentioned something about a delay.
Yes, this is critically important. Severe complications, like kidney failure or liver failure, might not show up for 4 or 5 days.
Days, not hours.
Days. This creates this insidious, dangerous window where terrible internal damage is happening silently.
So the puppy might seem okay for a day or two.
Exactly, which is why you absolutely cannot wait for severe symptoms. If you know they ate something, you act immediately. No symptoms does not mean no danger.
That really underscores the need for immediate vet care. Don't wait and see.
Please don't wait and see, because like we talked about, these drugs disrupt those vital prostaglandins everywhere. It's a widespread systemic effect.
A multi-organ impact.
Precisely, which is why a thorough vet evaluation is always needed, even if you only see one initial symptom, like vomiting.
Okay, let's break down those specific symptoms then. By organ system, gastrointestinal, you said that's often first.
Yes, most common, often the first signs. Things like loss of appetite, vomiting, and the vomit might have blood or look like coffee grounds.
Coffee glands. Okay, that's digested blood.
Yes. Diarrhea is common too. And watch for dark. Terry Stool's vets call it melena. That's also digested blood, a really critical sign.
Melena. Got it.
They might also show signs of abdominal pain, maybe drool more than usual.
And in really bad cases.
In severe cases, this can progress to actual ulcers, perforating, tearing a hole in the stomach or intestine. That leads to peritonitis, a massive infection in the abdomen. Life-threatening emergency.
Peritonitis. Okay.
Yeah.
And kidney damage. What does that look like?
Early signs can actually be increased thirst and urination, polydipsia, and polyuria. It seems counterintuitive, but it's their kidneys struggling.
Drinking more, peeing more?
Initially, yes. But in more severe cases, urine output might decrease or stop altogether. That's heading towards acute renal failure, a big risk, especially with ibuprofen doses over about 175 milligilograms.
How do NSAIDs actually hurt the kidneys?
They basically reduce blood flow to the kidneys. That impairs their ability to filter waste, which is their main job. And puppies with any pre-existing kidney issues are at even higher risk.
Makes sense. Okay, liver damage. You mentioned that can be delayed too.
It can. Signs might be more general at first, lethargy, depression, but look for jaundice.
Yellowing.
Yes, a yellow tinge to the skin, gums, or the whites of the eyes. That can indicate hepatitis, inflammation of the liver, or even acute liver failure.
And you mentioned something specific about ibuprofen and the liver.
Right, ibuprofen specifically has been linked to this rare but nasty condition called vanishing bile duct syndrome. It causes permanent liver damage and, again, might only become apparent days later.
Vanishing bile duct syndrome. That sounds serious.
It is. So liver symptoms might be delayed, tying back to that dangerous window we talked about.
And what about neurological effects? You mentioned seizures.
Yeah, those usually happen at very high doses, like over 400 kilograms for ibuprofen. You might see depression, wobbliness, or incoordination ataxia. Vets call it tremors, seizures, or even coma.
Ataxia.
And other critical signs affecting the whole body. Things like weakness, pale gums.
From bleeding, anemia.
Exactly, from internal bleeding. Collapse. In the most severe cases, sudden death. You can also see abnormal heart rhythm or blood pressure changes.
This potential for silent progression, damage happening for days while the puppy seems okay, that's just terrifying.
It really is. And it's precisely why you need prompt vet evaluation. Diagnostic tests, blood work, urinalysis are absolutely necessary to see what's really going on inside.
You can't just judge by how they look on the outside.
Definitely not. What looks like a minor tummy upset could be masking a life-threatening crisis, destroying their organs.
Okay. So emergency response. If you even suspect your puppy ate an NSAID, time is critical.
Time is absolutely of the essence. Act immediately. Do not wait for symptoms.
First step.
Call your veterinarian or a local veterinary emergency hospital right away. That's the single most important first step.
And if the regular vet is closed?
Then specialized pet poison control centers are your next call. They're staffed 24/7 by veterinary toxicologists who deal with this stuff all the time.
Do you have those numbers?
Yes. The ASPCA Animal Poison Control Center is 888-426-4435. And the Pet Poison Helpline is 855-764-7661.
Okay, 888-426-4435 for ASPCA, 855-764-7661 for Pet Poison Helpline. Good to have those handy.
Definitely. Just be aware there's usually a consultation fee for those services, but it's absolutely worth it.
Right. And when you call, what info do they need?
Be prepared. Have the exact medication name, the active ingredients, ideally from the bottle or package.
Got it. Keep the bottle.
Yes. Estimate how much they might have eaten and roughly when it happened. Know your puppy's current weight and list any symptoms you have observed, even if mild.
Okay. Be ready to go, too.
Yes. Be ready to transport your puppy quickly and safely to the clinic as soon as they advise it.
Now, first aid at home. What not to do seems really important here.
Crucially important. Never attempt to induce vomiting yourself unless a vet or poison control specifically tells you to.
Why not? Isn't getting it out good?
It can cause more harm. Improper induction can irritate or ulcerate the esophagus, or worse, they could inhale the vomit that's aspiration pneumonia, which is life-threatening itself.
Aspiration pneumonia, okay.
Plus, some poisons, though less common with NSAIDs, can actually be activated or made worse by water or inducing vomiting. You need expert guidance.
So no trying to make them throw up on your own? What else? No other home remedies?
Correct. Do not give any additional medications, human or pet. No home remedies. They can interfere with treatment or cause totally unforeseen problem.
Okay. What if they do tell you to induce vomiting? Is that common?
It's rare, usually only if the ingestion was very recent, the puppy has no symptoms yet, and you're far from a clinic. If they instructed, only use 3% hydrogen peroxide.
3%. Not the stronger stuff.
Absolutely, only 3%. The dose is typically 1 teaspoon per 10 pounds of body weight, given orally.
1 teaspoon per 10 pounds.
And they might say you can repeat that dose once after about 15-20 minutes if they haven't vomited. But ideally, you're already on your way to the vet by then.
And never use, what was that old stuff? Syrup of ipecac.
Never use syrup of ipecac. It's dangerous for pets. Stick to hydrogen peroxide only if instructed.
Okay. So while waiting for the vet, or on the way.
Yeah.
Just keep them calm.
Yes. Provide comfort, keep your puppy calm and warm. Try not to handle any areas that seem painful. If they aren't actively vomiting, maybe small sips of water. But again, best to confirm that with the vet or poison control first.
Right. Okay, so you get to the vet clinic. What happens then? What's the treatment approach?
It's usually multi-pronged. First is often decontamination, trying to remove any toxins still in the system.
Like inducing vomiting, but done professionally.
Exactly. The vet can use safe, effective prescription meds like apomorphine to induce vomiting if the ingestion was recent, maybe within the first hour or two.
Okay. What else for decontamination?
Activated charcoal is really key. It's given orally, often multiple doses. It basically binds to the toxins in the stomach and intestines, preventing them from being absorbed into the bloodstream.
Like a sponge for toxins.
Sort of, yeah.
Yeah.
But it has to be given carefully by a vet because there are risks, like aspiration or causing high sodium levels if not managed correctly.
So definitely not something to try at home.
Absolutely not. And in some cases, maybe if they ate a huge amount very recently or if vomiting isn't safe for some reason, they might do a gastric lavage, basically, stomach pump.
Okay, stomach pump.
Yeah.
Got it. So after decontamination, what's next? Is there an antidote?
That's the tough part. For most NSAIDs, there's no specific antidote.
No magic bullet.
No. Treatment is all about supportive care, supporting the organs that are being affected, managing the symptoms, and basically giving the puppy's body time to process and eliminate the toxin itself.
So what does supportive care look like?
Intravenous fluids, IV fluids, are the absolute cornerstone. They're critical for supporting kidney function, keeping the puppy hydrated, maintaining blood pressure, and helping flush the toxins out.
How long do they need IV fluids?
Often for at least 48 hours, sometimes longer, especially for kidney protection. They run them at a high rate initially.
Okay. What else besides fluids?
Gastroprotectants are vital. Medications to protect that damaged stomach and intestinal lining.
Like antacids.
Stronger than just simple antacids usually. Things like famotidine or omeprazole, which reduce acid production. Sucralfate, which coats ulcers like a Band-Aid. And sometimes misoprostol, which helps replace some protective prostaglandins.
How long do they need those?
Often for a week or two, sometimes longer depending on the damage. They'll also use antiemetics to control vomiting, if that's ongoing.
And if there's severe bleeding?
Then blood transfusions might be necessary to treat the anemia. They also provide thermoregulatory support, keeping the body temperature stable. And if there are neurological signs,
Seizures and stuff?
right, then they'll use anticonvulsants or muscle relaxants.
It sounds like really intensive care.
It absolutely is. And in the most severe situations, like if the stomach is actually perforated,
The hole we talked about. Peritonitis.
yes, then emergency surgery might be the only option to try and repair the hole and clean out the abdomen. But that's an extreme measure. The prognosis is often guarded to poor even with surgery because the damage is already so extensive.
Wow. That's a lot. Which really brings us back to prevention.
Exactly. Prevention is everything here because this is truly 100% preventable with careful management.
It really comes down to just anticipating that puppy curiosity, doesn't it? I mean, we've all probably left a pill bottle on the nightstand or kitchen counter.
So easy to do.
Mm-hmm.
Just takes a second of distraction. But that innocent oversight can turn into an absolute nightmare for a curious puppy.
So the golden rule.
Non-negotiable. Never, ever administer human medications to your puppy, period.
Human NSAIDs are for humans.
For human metabolism. What helps you can seriously harm or kill your dog. Only use medications specifically prescribed and formulated for dogs by your vet.
And even with vet meds, don't mess with the dose.
Never. Don't adjust the dose, the frequency, how long you give it without explicit guidance from your vet. Follow their instructions exactly.
Okay. So practically speaking, secure storage. What does that really mean when you have a determined puppy?
It means truly secure. All medications, human and pet, need to be in their original containers, clearly labeled, and stored somewhere completely inaccessible.
Not just out of reach on a counter.
Definitely not. Puppies can jump, climb, knock things over. Think high cabinets, loft drawers. Out of reach is often within reach for a determined pup.
And child-safe caps aren't enough.
Often not pet safe at all. Puppies can chew right through that plastic in seconds.
Good point.
It's also smart to store pet meds and human meds completely separately. Reduces the chance of grabbing the wrong bottle in a hurry.
Okay. Any other storage pitfalls?
Yeah, be careful with flavored medications meant for other pets, like horses or farm animals. Those can smell really tempting to a dog.
Ah, good one. And the topical creams.
Right. Prevent your puppy from licking any skin where you've applied medicated creams, especially dangerous ones like that Fluorosil we mentioned. Keep the area covered or keep the puppy away.
Okay. What about getting rid of old meds? Proper disposal.
Also crucial. The safest way is community drug take-back programs. Check with your local pharmacy or police station.
Drug take-back. Okay. If that's not an option.
If there's no take-back program and the medication isn't on the FDA's special flush list, which most aren't, you should mix the meds.
Don't crush them.
No, don't crush tablets or capsules. Mix them whole with something undesirable, kitty litter. Used coffee grounds.
Make it gross.
Exactly. Put that mixture in a sealable bag or container, then throw in your household trash. That helps prevent pets or even wildlife from dumpster diving and getting into them.
Good strategy. Okay, so the vet is key here, your most valuable partner.
Absolutely. Your vet has the expertise to determine if an NSAID is needed, which one is safest for your specific puppy, the right dose, and how to monitor for side effects.
And you mentioned blood work before starting.
Yes, especially for long-term therapy, vets usually recommend pre-screening blood work. It assesses kidney and liver function before starting the drug. Super important for puppies whose organs are still developing, and it can catch underlying issues.
Makes sense. And ongoing monitoring.
If a puppy is on an NSAID continuously, periodic blood and urine tests, maybe every 6 to 12 months, are a good idea to catch any developing problems early.
And avoiding dangerous combos. That seems critical too.
Hugely critical. Never give more than one type of NSAID at the same time. Like don't give Rimadyl and then also some aspirin.
Got it. One at a time.
And never give an NSAID concurrently at the same time as a corticosteroid, like prednisone.
Why is that combo so bad?
It massively increases the risk of severe side effects, especially serious GI ulcers and kidney damage. It's a really dangerous combination.
So if switching meds,
Vets recommend a washout period, usually 5 to 7 days between stopping one NSAID and starting another NSAID or starting a steroid. Gives the body time to clear the first drug.
washout period. Okay. Are there alternatives to NSAIDs? Things to maybe reduce the need for them?
Definitely. Always discuss these with your vet. There are nutritional supplements that can help support joint health, like omega-3 fatty acids, glucosamine, chondroitin, MSM.
The joint supplements?
Exactly. Physical therapies can also make a big difference. Physiotherapy, even things like therapeutic laser or electrostimulation. Simple heat application can soothe joints.
The lifestyle stuff.
Absolutely.
Yeah.
Weight management is huge. Keeping your puppy at a lean, healthy weight reduces stress on their joints. And appropriate controlled exercise helps maintain muscle mass and joint mobility. These can all lessen the reliance on medication.
Okay, so looking long term, if a puppy unfortunately does get exposed and treated, what's the outlook?
It's highly variable. Really depends on factors like the dose they got, how quickly treatment started, how thorough it was, also the duration of exposure, how much organ damage occurred initially, and the puppy's underlying health. Any pre-existing kidney or liver issues, dehydration at the time, it all plays a role.
So best case scenario.
Mild cases, caught very early, treated aggressively. The prognosis for a full recovery is often excellent.
That's good to hear, but worst case, like that stomach perforation.
Yeah, if gastric perforation happens and leads to peritonitis, the prognosis becomes much more guarded, even poor. Even with surgery and intensive care, sadly, many pets might not survive that level of complication.
It's just devastating. And even if they survive the acute crisis, does recovery always mean they're totally back to normal? Could there be lasting effects?
That's a really important question. Recovery from the immediate poisoning doesn't always mean a complete absence of long-term impact. There can definitely be hidden or lasting damage.
Like what?
Well, you can see chronic kidney damage. It might be permanent, requiring lifelong management, special kidney diets, maybe subcutaneous fluids at home, regular vet checkups, and blood work monitoring.
Lifelong kidney management.
Oh, wow. Similarly, chronic liver damage can be permanent. We mentioned that vanishing bile duct syndrome with ibuprofen that can cause irreversible liver issues requiring long-term supportive care.
So the organs might never fully recover.
That's possible.
Yeah.
Puppies might also develop persistent gastrointestinal issues afterwards, like a chronic sensitivity, maybe recurrent ulcers, just ongoing tummy upset that needs careful management.
That sounds challenging.
And sometimes the NSAID exposure itself, even if treated, can kind of unmask or worsen an underlying disease that wasn't obvious before.
Like a hidden kidney problem.
Exactly.
Yeah.
Maybe they have mild subclinical kidney dysfunction that wasn't causing symptoms, but the stress of the NSAID toxicity pushes it over the edge. This really highlights why that baseline health assessment and blood work before any medication, even vet-prescribed ones, is so important, especially in young, still developing puppies. It helps identify those hidden risks.
That makes so much sense. Okay, so let's just quickly recap the absolute key takeaways from this deep dive. NSAID toxicity in puppies. It's severe, potentially fatal, usually from them accidentally getting into human meds.
Right. Ibuprofen, naproxen, aspirin, acetaminophen, big dangers.
And puppies are uniquely vulnerable because of their metabolism, their size, leading to rapid, widespread damage, GI tract, kidneys, liver, even neurological issues.
The symptoms can be varied: vomiting, diarrhea, melena, increased thirst, lethargy, jaundice. But remember, the dangerous delay is possible.
Yes, the silent damage. So act immediately. Call your vet or a pet poison control center. Time is critical.
Absolutely critical. And remember, never induce vomiting or give home remedies unless specifically told to by a professional. It can make things worse.
Prevention is truly the best medicine here.
It's the only medicine you want to rely on for this.
Yeah.
Proactive prevention, secure medication storage, proper disposal, and always consulting your vet for pain management. That's the strategy.
It really makes you think how interconnected our lives are with our pets. How just being aware of a seemingly small detail, like which pain reliever you use and where you keep it, can have these profound life-saving consequences for, the most vulnerable members of our family. So the final thought for everyone listening, what really stands out to you about how easily preventable this truly devastating poisoning is?